Hi, it's Matthew Links and welcome to this short video on how to see a patient on a clinical trial. It's aimed at anyone who is responsible for looking after a patient on a trial as an inpatient or outpatient. The context is oncology, but it's equally applicable to others. So our learning objectives today are to use clinical trial experience to inform your overall practice, understand how the documentation required for a clinical trial should be done, to utilise strategies that minimise the amount of data queries and that ensure protocol compliance, to be able to grade adverse events and be able to manage a serious adverse event according to the protocol. What can I learn from a patient on a clinical trial is the first question. So first of all, you can learn experience with managing new drugs. You can learn to grade toxicities using CDC criteria. Learn best practice for managing side effects and dose modification, and importantly, you can develop perfect documentation which you can use as a template for your usual practice. So it's important to remember that clinical trials are codified best practice, and a group of experts in the protocol have defined exactly how you should deal with each eventuality. The most important thing to remember, though, is that the documentation that you make needs to be perfect. This ensures that the quality of the trial is up to standard. Now, a data query happens if there's any inconsistencies in a trial record. And what will happen is that that will generate a trail of time-consuming activities that will consume a lot of your time, but more particularly the trial coordinators. And examples of this are automatic queries that happen if a symptom has been stopped but never got started. Same for medication, if there's missing data such as ECOG performance status, or if there are relevant negatives that can't be confirmed in the trial in the clinical record. So how do you avoid this? Well, before the visit, know what assessments, investigation and documentation need to be done in the protocol, and review any previous symptoms and ongoing toxicities, and it helps you can copy them into the current document, and then review results and any required actions. During the visit, carry over any existing problems and grade or cease them. Document the start dates of new symptoms and the stop dates of old. Document any new medications when they start and stop. Very importantly, and often forgotten, document the performance status and document any changes in the examination. So what do you do if there is an adverse event? Well, adverse events are graded by the CTC criteria, and we'll come back to that later. And the event should be described in enough detail in the record to be able to confirm the reason why a grading is given. The protocol will have rules for management of any toxicity, and these should be followed. And serious adverse events have their own particular rules. So let's look at an example. If a patient has diarrhea, you can look up each of the different types of disorders, look under gastrointestinal disorders. In alphabetical order, you'll see that every conceivable gastrointestinal disorder is there. The first thing is to be careful about what you call it. Be consistent about whether a toxicity is colitis or diarrhea. Secondly, you need to take a history that allows you to grade. So if you don't normally take history of what the baseline number of stools are and how many exactly there are, then you need to, because this is the information that's required to grade this toxicity. General toxicity is graded from 1, mild, 2, moderate, 3, severe, and 4, life-threatening, and 5 is death. A serious adverse event has a specific definition, and it's anything that results in death, life-threatening, requires hospitalisation, or alternatively a prolongation of existing hospitalisation, a significant permanent disability or defect. Now, if this happens, you need to tell the coordinator, because SAEs need to be notified immediately to the sponsor. So if it's overnight, that can be first thing in the morning. The important thing is the coordinator knows so that they can nominate, tell the sponsor. So, key points are, first of all, clinical trials are codified best practice. The documentation needs to be perfect. Don't forget performance status. Carry over previous toxicities and document concomitant medication. Describe the toxicity so they can be graded. Follow the protocol for treatment modification, and if in doubt, ask. Disregard and always remember the trial coordinator is your friend. They will help you and save a lot of problems. So ask. And there's some further reading. So thank you for your attention, and that's all.